Hi guys, this video is about compartment syndrome, or it's also actually these days called chronic exertional anterior lower leg pain. I know it's a mouthful, but you'll understand where that long name comes from in a minute. So in this video, I'm going to chat about what it feels like when you have it, what we think is causing it, what treatments may be useful, and then specifically how you can actually adjust your running form to help with your recovery from this. So my name is Maryke. I'm the physiotherapist from sportsinjuryphysio.com, where you can get online physiotherapy assessment as well as treatment of your injuries. Have a look at the description of this video if you want more information. Okay, let's dive right in. So what is anterior compartment syndrome, or chronic exertional, what's that long, pain in the lower leg? It's basically, if I can bring this down, it's when you experience pain and symptoms in this bulky muscle, bulk of muscle in the front of your shin. So it's not on the shin bone, it's in the muscle itself. Now, this pain, if it's this condition, if it's compartment syndrome, only comes on when you exercise. So that sets it apart. And importantly, that sets it apart from other conditions that you can get there, because shin splints can feel very similar. Stress fractures can feel pain in that area. Referral from nerves can feel the same there. But with this condition, the pain or discomfort or symptoms that you feel only comes on as you exercise. And then when you stop exercising, it disappears within a minute or so of resting. But if you start again, it builds back up. So typically, when you start exercising, you're fine. And then it slowly builds up to the point where you have to stop exercising because it's just too painful or too uncomfortable. As you stop, then it goes away, and sometimes people can do a little bit more, but then they have to eventually give up. So how patients describe the pain is like an extremely tight feeling, or it can be quite an excruciating pain as well. Sometimes they can have a bit of tingling or numbness. And other times they can even experience that their foot drops, that it doesn't want to work properly. Now, you know that you'll notice that things like foot drop and tingling can also be nerve conditions. So it's really important to have it diagnosed properly. Let me just make sure I'm not leaving anything out. Yes, and they really don't have pain if they rest. So there's no aching or anything at night. As soon as they rest for a few minutes after they've exercised, the pain usually settles fully. Now, why does this happen? So the old theory used to be that it was because the fascia is too tight there. Now, every single cell, muscle cell, has a layer of fascia around it. These muscle cells are grouped in bundles, and that's got fascia around it. So fascia is like thick, sinewy tissue, the white stuff and meat that gets stuck in your teeth. And then a muscle itself has a layer of fascia around it. And then loads of muscles. That's why we call it the anterior compartment, because there's more than one muscle in there. And they are all grouped with a nice thick layer of fascia around it. Now, what we used to think is happening here is that as we exercise, our muscles swell because they fill up with blood and they just become a bit bigger. And if this fascia doesn't give enough, it can't extend, and the muscle, the pressure that increases effectively cuts the blood supply off. So then the tissue becomes starved of oxygen, and it creates that pain and that really tight sensation. As soon as you stop, the muscle decreases in size and blood flow returns, and that's why the pain goes. The tingling and numbness that you can feel of the foot drop also was thought that is because of the pressure on the nerve then, because the pressure in that compartment becomes so much. But recently, there's another theory that's sprung up, and that's that it's not actually because of the tight fascia, but because you're overusing the muscles in that compartment excessively when you exercise. And specifically, the tibialis anterior muscle. And in a minute, when I talk about treatment, you'll understand that a bit more. So we've got two theories here, and neither of them has been proven to always be true. My gut feel is that you have, in some cases it may be this one, that there's things that's too tight, and other cases it may be that actually you're just really super overworking that muscle. So let's look at treatments. Traditionally, because it was thought that things were too tight, conservative treatment has consisted of different techniques to try and loosen that off. So myofascial release techniques, dry needling or acupuncture, stretching. But it's really not been successful. That type of treatment does not help compartment syndrome. So then the only treatment that seemed to help some patients was surgery, where they go in and they cut the fascia open that the muscle can expand when you exercise. Now, that does help for some patients, but there's a large portion of patients who doesn't find any benefit from there. In recent years, because they've started thinking that, oh, we think it may be that you're really overusing and overstraining that tibialis anterior muscle when you're running, the focus has shifted to actually change the way that runners run in order for them to use less muscle activation in the tibialis anterior muscle and more of their calf muscles. And the research is currently showing that that can actually have a good effect on decreasing pain. It's by no means a magic bullet, and I think it's because it's so difficult to change the way that people run, because we're all different and we all naturally want to go into different running styles that suit us best. But there's definitely evidence that it's worth trying to change your running style if you're struggling with this type of pain. So what are we looking to change when we want to change a runner's running style to help with compartment syndrome? The tib and muscle, which is in theory the one that causes most of the trouble there, is the one that pulls your foot up, so dorsiflexus. So it does that movement when you run. Okay, so the strategies we use when we change somebody's gait for running is all about reducing how much dorsiflexion activation they get when they're running. So it's about where they place their foot when they land, so there's less dorsiflexion there. Also during the swing phase, as you bring your leg round, how can you use less activation or get less activation in that tib and muscle? And there are certain things that's been shown to be useful. So if you ever listen to any of my other injury prevention running tips and injury treatment running tips, you'll see the same thing coming up for certain reasons and for certain conditions. So the first one is that you can increase your step rate. So that's literally how many steps you give in a minute. And what they found was that when a runner increased their step rate, there's less activation of the tib and muscle as they swing the leg through. So that's one way that you can do it. Now, how does one do that? I've written a whole blog post on it, but in short, first you need to know how many steps you give in a minute. And you can either, your watch may be able to tell you that, or you can just count how many you give in a minute. Now, from the research, it's been shown that the best way to increase that is not to immediately jump to what should be ideal, but just try to increase by 5% or 7%. And two methods that seem to work is either you monitor it on your watch as you run, or you can download a metronome app, set the metronome to the rate you want, and just try and step in time with that as you run. So those two things are something that you can try out and play with. Then, if we want to reduce dorsiflexion as you land, the two ways that we can do that, the first is to try and decrease overstride if you're running with overstride. Let me demonstrate what I mean with that. Oh, get this out of the way. Now, can I get you to see my feet? Yes. So, sorry, this is going to make a noise. There we go. Okay, so if we think of overstriding, it's when a runner places his leg or his heel out quite far in front of his body as he runs. And you can see, by placing my foot there, I've already got dorsiflexion in my ankle because I'm doing a heel landing there. So by landing more underneath you, can you see how the dorsiflexion and the activation decreases? And that goes hand in hand with trying to land a little bit more midfoot or forefoot running, which can also help this because immediately that decreases the activation in the tib and. So I just want to see if you can see my whole body. I don't know why I can't get myself in properly today. So if I can demonstrate, I'm going to pull this back so you can see more of me as I do this. There we go, that may work. And I may just, whoops, come on. That's what I wanted to do. Okay, let's see if that looks better. Cool, so if we think of overstriding, running like that you step in front of you. Now, if you want to correct that, one of the easiest ways that I find is if I lean slightly forwards with my torso, and then when I, obviously I've got to hold on now because I'm not running. When I make contact, I think of trying to strike underneath me. So instead of feeling there, I try to get it that I strike underneath me. And you can use this as an exercise that you practice it before you go out for a run. That you just see, how does it feel when I actually make contact there? Because immediately you'll find that you tend to then make contact more with your midfoot than your heel. So you can practice this a bit before you go out. So that's how I get my patients to be a little bit more midfoot run, because I find often if I get them to run on their forefoot, they can overdo it. But if you work with a running coach, they may be able to really give you really good tips on how to do that. Importantly, you have to make sure that you slowly introduce these methods. Because if you're used to running on your heel and you all of a sudden start doing forefoot running or midfoot running and you go out for long runs, your Achilles tendon and calf muscles have not been strengthened enough to cope with that load, and you may end up with other injuries like calf strains or Achilles tendinopathy. So the best way to teach yourself new running styles and new ways of running is through walk-run programs. So if you've got severe compartment syndrome, you may not be able to run far in any case at this point. So it's a very good time to implement it, that you walk for a minute and then just do half a minute or up to a minute of trying to change your running style and running maybe a little bit more on the forefoot or on the midfoot and trying to strike underneath you. And then you walk again. And then you try it again. Because if you're going to try and do a continuous run with a new style, you may find that you lose concentration and you just revert back to what you've been doing. Or you end up overstraining things that's not used to it. Excellent. That's everything I had to say for this video. So let me know if you've got any questions. Remember, if you need more help with your injury, you're welcome to consult me via video call. Link is in the description of this video. Take care.